Even as the governor opens COVID vaccination to more people, there's one group that has been left behind. Health reporter Benita Zahn joins us now with more. Benita.
Elaine, we're talking about the 8,000 New Yorkers who got their health care at adult day health care programs pre-pandemic. Now, those programs ordered shut by the state are still closed, leaving many of those clients no way to get the vaccine. Amanda Grum wanted to get a COVID vaccine. Instead, she caught the virus. It happened at the emergency department of a local hospital, a trip she could have avoided if she was getting regular care at her adult day health care program in Valencia.
And there was a person there who came in by ambulance. They didn't think he had COVID. He had COVID. He refused to wear a mask. Mine slipped below my nose, and I caught COVID.
She recovered at home, alone, because her experience with home health aides has been disastrous, firing 3 of them for falsifying timesheets, sharing her personal information, and then something out of a crime novel.
And then also she was taking me to stores, having me sit in the car while she was robbing them.
And without the support at the adult day health care program, her mental illness worsened, and she needed hospitalization.
I'd say about 2/3 of our population has some degree of chronic and severe mental illness.
Angelina Blasic is a social worker at a program in Binghamton. She says the emotional toll of the pandemic is especially severe for this population, heightened by their isolation.
Some of them we don't even know. Some people we haven't been able to reach. We've had folks who have literally not left their homes in almost a year.
And since many, like Amanda, can't navigate the system to make a COVID vaccine appointment, they're left vulnerable.
Our doors should be open so that we can get people vaccinated. We can work directly with a local pharmacist to come into the program and vaccinate all of the registrants.
Like they did with flu vaccine. Even when they're allowed to reopen, there'll be 12 fewer programs statewide, 4 in the capital region, all part of the EDI system. They've closed. They couldn't hang on. And every day of waiting for the remaining doors to open is another day people like Amanda suffer and risk contracting COVID. I spoke with a person from the EDI who tells me they hope to open a different type of program. This would be under federal regulations that offer similar services next month, so the folks who attended the adult day health care program can switch. And yes, I reached out again to the state health department. Nothing, Elaine, has changed.
Yeah, you've tried to contact them many times about the store.
And nothing's changed. They keep saying they're looking at it. And that's cold comfort to this population.
You're right. Thanks, Benita.